children specific, I think the same sort of public health measures that we're recommending for adults applies. So staying home, trying to be physically distant, washing your hands regularly, avoid touching your eyes, your nose, and your mouth. I think that's with children. That's probably the biggest thing is the touching the eyes, nose, and mouth, which is how the virus will actually get into someone. And so the reality of it is that it's a bit of a challenge for children, but I think the same public health measures would be recommended for them as well. The concept of an asymptomatic carrier applies again both to adults and children. So again, because the virus tends to affect people differently in different ways, you can be an asymptomatic carrier, and there's some fairly reliable literature to suggest that you can still pass on the virus during an asymptomatic phase. And so the reality of it is that, again, by applying these public health measures of washing your hands, using hand sanitizer, staying at home, and then trying to be physically distant from everyone, that would apply to children as well. At home, I think things that we may overlook is the cleaning of toys, cleaning of the rooms on a bit more of a routine basis. Those are the kinds of things that you could certainly look at from a focal point for kids. Again, with kids, with our medicines, they're dependent upon devices to get the drugs into them. So making sure that they themselves know how to use the device if they're using it on their own, and getting them to use the online tools to review inhaler technique. Or if you've got asthma yourself and your child has asthma, maybe practicing, using your inhalers together so that you can each be each other's policeman or policewoman in terms of trying to make sure that you are using the devices correctly for each other.